Hi guys, I'm Carrie Davidson again. I am the Move Well Fitness Manager. So I serve as the exercise physiologist here for our UK Health and Wellness program. I am talking about exercise and dementia slash Alzheimer's. This is kind of where we're going to go today. We're going to talk about the different mechanisms of physical activity on Alzheimer's disease, the benefits, what the protocol really should be, some other considerations, and some resources. Now, if you've been listening to Dr. Karen talk here about the MIND diet, she was giving you a very specific diet that has been researched and sort of not proven because of that whole causation thing, right? But it has been shown to be beneficial for Alzheimer's disease and dementia and for the brain, essentially. Now, with exercise, things are a little bit different because there is so many factors that go into a person's physical activity and physical activity levels that to be able to have apples to apples, it would be really, really difficult. There have been a lot of studies in mice because you could actually make them a little bit more genetically close. But the research in humans, as you might imagine, is very difficult to control for some outlying factors. So I'm going to tell you what all the research is, just not one specific protocol, whereas like the MIND diet is one specific protocol. This is going to be sort of a generalized research review. So you guys probably know better than anybody else the difference between dementia and Alzheimer's. Dementia is a decline in mental ability, and Alzheimer's is the most common cause of dementia. So dementia is the big umbrella, and then Alzheimer's disease is the smaller umbrella. And it is caused by damage to brain cells. It is not caused by aging. Not everyone who ages is going to have dementia. Now, it is a risk factor for sure, but not everyone who ages, because we all are going to age and are aging, is going to have dementia. But it does affect our thinking, our behavior, and our feelings. And then Alzheimer's specifically is the most common cause of dementia, accounting for 60 to 80% of the dementia cases. And it usually affects our learning first. And that's important because we want to make sure that we do something on the preventative side before we are already there. Terry and I were just talking about that right before the presentation started, that we want to go ahead and be physically active and eat the right foods now, so that as learning gets affected later in our life, we're not trying to learn something new. It's already been a habit for us. So that's why that's important, and I wanted to point that out for us. So the reason that exercise works now, but let me pause right here for just a second and say, we all know that exercise is beneficial for our cardiovascular health, for our muscle strength, for our muscle endurance. We probably even know it's good for our mood and good for our sleep. And exercise has so many benefits, right? It can lower our blood pressure and help decrease risk of all sorts of chronic diseases. Those are all well-known, well-researched, well-communicated benefits. But what we don't always communicate well, what the fitness world doesn't always get to communicate well, is the benefits on the brain. And like I said, the research is there. It just has so many factors that go into it. So physical activity, that's what PA stands for. Physical activity increases our cardiac output and therefore blood flow to the brain. So if dementia is caused, and it is, dementia is caused by brain cells that are dying off or atrophy, just like a muscle that doesn't get used gets smaller and atrophies, the same thing can happen in the brain. And that's the cause of it. So physical activity can increase our cardiac output, and cardiac output sounds fancy, but really it's just our heart rate, like how fast, and our stroke volume, how hard. So essentially it's how much our cardiac output we can pump more blood to the brain with physical activity. The more physical activity we do, the more blood we can pump, and it goes to the brain. So we have an increased blood flow that can then lead to neurogenesis, which is building more brain cells. So if dementia is the dying off, then exercise can help in neurogenesis and building brain cells. And it also has been shown to increase hippocampal volume. So that again sounds really fancy, but the hippocampus is deep in our temporal lobe, and it is the center for learning. learning. So if we can increase the size of, or the capacity, I should say, if we can increase our capacity for learning, that is one more step in the direction of prevention for dementia or Alzheimer's. And I'm going to keep going as long as I can. I did this the other day, and by the end of the presentation, my voice was gone. So I'll just keep going. Physical activity also has been shown to increase BDNF, which is a protein in the brain, as well as other brain chemicals, but it is protein in the brain for synthesis. So that is super, super important when we're talking about the way that our brains function. And then aerobic activity, and we're going to get into that here a little bit more in just a second. So cardiac or aerobic increased the gray and white matter. So I was looking at all the different studies and pulling out all the different mechanisms and the way these things work. And so cardiovascular exercise was shown to increase the gray and the white matter, so the actual brain tissue. But they also looked at that compared to people who are stretching. So just doing a stretching routine, and that did not increase the gray and the white matter. It's still important. It's still important, but it wasn't necessarily decreasing any risk for us. So aerobic activity. So again, you guys know benefits of exercise are many, but in relation to this topic of dementia and Alzheimer's disease, it can decrease depression, which is a high risk for people who have dementia and Alzheimer's are at higher risk for depression. It improves mortality, of course. It inhibits or delays the development of Alzheimer's disease because of the mechanisms that we just talked about. It gives us better posture and balance. Physical activity gives us better posture and balance. And so oftentimes whenever we have dementia and Alzheimer's disease, then that can affect our posture and our balance. And then overall better cognitive function. So because of all those mechanisms that we just talked about, we can gain all these great benefits from physical activity. So the big question is how much and what kinds, right? That's what everybody wants to know. And so we have looked at lots of different research, different studies, different populations, different ways that they framed it. And we found that walking improved cognitive function, posture, and motor function. So you can think about these things as, sitting upright and motor function are important for our activities of daily living. So we're not necessarily saying, we're going to go run a marathon. That's not what we're talking about. We're talking about activities of daily living, like be able to sitting upright in the bathroom or in the bathtub. Motor function, so being able to still use our fingers to write or do different things that we need to do. And then muscle strength training improves balance and posture also, which can help us prevent falls, which are super prevalent in this population. So falling oftentimes can lead us onto a downhill spiral of when things start really going poorly for those with dementia or Alzheimer's disease. So before I get into these recommendations, I want to also talk about the quote unquote generally healthy population, ACSM guidelines. So the American College of Sports Medicine puts forth guidelines for physical activity for generally healthy adults. So these are not people with chronic conditions. They're not people with specific goals like to lose weight or lower their blood pressure or things like that, or dementia. So generally healthy population for general health benefits. And the recommendation is for cardiovascular or aerobic exercise. It should be 30 minutes, moderate intensity, 5 days a week. 30 minutes, moderate intensity, 5 days a week. That would be something like walking or swimming, biking, things that are large muscle groups, rhythmic, move in a pattern. You get the same benefits if you want to work vigorously for 20 minutes, 3 days a week. So this would be more like running or cycling very quickly or aerobic dance, things that make you work a little bit harder. You get the same general health benefits. Now for strength training for generally healthy people and for general health benefits, strength training is really kind of specific. And this is where you really need to look at your goal and probably talk to a health fitness professional, is 2 to 3 sets 8 to 12 reps, major muscle groups on 2 to 3 days per week. Now that's really, really general. So, for somebody who's looking to lose weight, we're going to train them differently than somebody who's looking to put on a lot of muscle mass. And the weights would be different. The sets and reps would be different. The frequency during the week would be different. All those things would look differently dependent on someone's strength goals, but the guidelines are there. And then there are guidelines for flexibility or mobility, which is really our joint's ability to take it through a full range of motion, our body's ability to move a joint, like our shoulder, through the full range of motion. And again, it's 5 days a week, 3 sets, 30 seconds from all major muscle groups. So I'm gonna have to take a pause here for just 1 second. So those are the general guidelines for generally healthy people for general health benefits. Now, I want us to look at the slide and look at what the ACSM, specifically exercises medicine, what they recommend for people with Alzheimer's disease. And so for cardio or aerobic, it's still 5 days a week, just like the generally healthy population. It still is moderate or could be moderate. It should be light to moderate as tolerated by the person. And it should build up to be somewhere between 30 and 60 minutes over the course of the day. So even for a generally healthy population, we would say you can get your 30 minutes of moderate intensity accumulated over time, like over the day. So 10 minutes in the morning, 10 minutes at lunch, 10 minutes in the afternoon. That can definitely get you to that 30 minutes a day. So the guidelines for this are not that much different, except that you may not be working quite as hard. So instead of moderate to vigorous, this one's going to be light to moderate. So it's not that much different. The strength training for guideline for this is also 2 days a week, which is generally what I start even generally healthy people with. In a light to moderate, 2 sets of 8 to 12 as tolerated. So again, they're not that different from the generally healthy population guidelines. And it really is going to depend on this point, where the person is in their physical fitness already. Have they ever lifted weights in the past, or have they not? Do they know the patterns and the form and the technique already, or do they not? Is this something that we're learning for the first time? Which again brings me back to the point I was making at the very beginning, that Alzheimer's disease and dementia keep us and affect the part of our brain that is learning centered, learning focused. So if we can learn these things before the onset of such diseases, then we're in a much better space to continue a habit and to continue muscle memory and continue with routines that we already know, that we don't have to learn for the first time. And then instead of stretching or flexibility or range of motion, they talk more about balance for this population, because that is a high risk factor for falling. And so if our balance is off, we are more likely to fall, to trip over a rug, to not pick our foot up all the way up over a curb, something like that. So daily balance exercises can go a long way for this population. So I want to, I think Terry sent out to you guys a handout already. So I'm actually going to swap my screen here and show you the handout that I gave to you all. If you don't have it yet, then you will be getting it. But this is from the exercises medicine portion of the ACSM, which I've talked about as the American College of Sports Medicine. And this is how to be active with Alzheimer's. And so they break this up for us into cardio, strength training, and then other. And so I wanted to make sure that you all had that. And can look at that and can use it as a takeaway, and maybe reference it again in a year or 5 years, or if you're caretaking someone who is already there, that you could adjust this as time goes by. So I just wanted to make sure that was there for you guys. All right, so let's go back from this current slide. So here are some things to consider when you're talking about doing exercise for or with or helping others who have some form of dementia. So exercising with someone can be a great idea for this population. For one, it's safe, so that if they were to get hurt or injured, then someone else is there. But also it starts the habit in the caretaker, just like it becomes a habit for the patient. So it's a win-win on both ways. It's safe, but it also is duly aligned, so to speak, for behavior change for both parties. And then, like I mentioned, you can break it up into mini sessions. So instead of going out for a 30-minute walk, you could go for a walk for 10 minutes here, 10 minutes there, and 10 minutes again before the end of the day. And the same thing would hold true for any strength training exercises. So if we're, putting together a regimen of twice a week, we want to work 2 sets of 12 of our major muscle groups, which might include, a chest press, a row, an overhead, a pull, whatever these exercises are. You don't have to sit down and do all of them at the same time. It might be that you can sit down and do 10 of these or 12 of these one set. And then, another break in a day, you can do this 12 of another set, and then 12 of another set. And you can get them done throughout the day. It's going to feel differently in your body, but sometimes that's okay. That's a good thing. So you can break it up into mini sessions. Or just because we don't have an hour carved out and this is our quote unquote exercise time or physical activity time, doesn't mean that it doesn't count. It still counts, even if we break it up throughout the day and end up with 24 hours of strength training or cardiovascular exercise. It is also known that our dementia and Alzheimer's friends usually have better cognitive abilities in the morning. So the morning might be the better time to do some physical activity. The motor skills are usually better too in the morning. So that might be the best time to do it. So if you're a caretaker of a patient with one of these, then it might be part of what you do on a daily routine and starts with this. And that may not work out for everybody. But it has been shown to be helpful. The other thing I want to point out is we don't want to hold our breath. So a lot of times when we are strength training, especially if we're lifting a very heavy weight, we naturally will hold our breath and create a pressure system, which helps us to brace our core. So it can be a very good thing if we hold our breath, create this pressurized sort of cone inside the body. It treats it like almost like a brace and gives us bracing, internal bracing for core strength so that we can lift that heavy weight. But it's important in this population not to hold the breath because we're cutting off oxygen to the head, to the brain, which is not a good plan. Also, it can spike our blood pressure. That's in a normally healthy population as well. It can spike the blood pressure and cause us to pass out. It's called the Valsalva maneuver. So we want to make sure that that's not the case in our dementia and Alzheimer's population when we're talking about exercise, not holding the breath. And then also if we can combine exercise types, so strengthening, balance, the range of motion, cardiovascular exercise, if we can combine them into one sort of workout or one sort of session, and that sometimes can be better for the patient without having to remember to do all the different things that they have to do. So something like yoga or Tai Chi, where they're going to combine these 2 or 3 different sorts of types, can be really, really helpful in this population. So I just want to point out that, so for yoga, as an example, is a strength training, can be, depending on what kind of yoga you do, a strength training exercise as well as flexibility and range of motion. Tai Chi is more balance oriented as well as flexibility and range of motion. And then I actually just saw research yesterday that came out that HIIT workouts, HIIT stands for high intensity interval training. So where you work really, really hard for a short amount of time, like 30 seconds, and then you rest. So it's an interval, hard work, rest, hard work, rest, where HIIT can have an effect on our brains. So more research is probably going to need to be done on that area before we can throw those into the guidelines. And HIIT also has a higher risk of injury just overall because of the fast-paced nature. But anyway, if we can combine some of these into one exercise session, then that typically goes better for the for the patient. So I do want to point out just a few of these different research articles that I was looking at, and some different websites, specifically that bottom one, alz.org, which if you're already working with somebody that has Alzheimer's or dementia, this is a great website, a great organization to look at. So, all right, what questions do we have? I will do my best. I'm about to lose it again here.